morning. Let's discuss on the topic congenital heart disease. What is congenital heart disease? Congenital heart disease are abnormalities of the heart or great vessels that are present at birth. Okay, congenital heart disease are of two types, that is acyanotic and cyanotic. Today we are going to discuss on acyanotic. What is acyanotic? Acyanotic is asymptomatic. That is, there won't be many symptoms. Okay, next let's see. In acyanotic is consists of many diseases like ASD, VSD, PTA. Today we are discussing on ASD. What is ASD? ASD means atrial septal defect. Okay, now we are seeing what is atrial septum. Atrial septum separates the left atrium from right atrium. That is, center there is a separation of left atrium and right atrium. That is called atrial septum. Okay, what is the defect? Means ASD. What is ASD? ASD means the defect in the septal. If there is any hole or any defect is called ASD. Okay, that is called ASD. Next, how is the septum development done? How is the septum development done? Septum development is done. How means first a tissue layer from the heart. It is how a tissue layer from the heart. That is, see, a tissue layer from the heart grows downward. Okay, this is called septum primum. Okay, a tissue layer from the heart grows downward called septum primum, and there is a opening here called ostium primum. Okay, this is ostium primum, and can you see, this is ostium primum. This opening is called ostium primum, and the tissue downward growth is called septum primum. Okay, next ostium primum is called the first opening. Okay, ostium primum is called the first opening. Okay, so septum primum grows downward and the end opening is called the ostium primum. This is called the first opening. Okay, this gap completely closes when this septum primum grows downward and fuses with the endocardial cushion. This is the endocardial cushion. Okay, when the septum primum grows downward and closes with the endocardial cushion, the chamber separates. Then next, a tissue grows downward. That is, a tissue grows downward. See, a tissue next means right of this. Right, a tissue grows downward. This is called septum secundum. Okay, this is called septum secundum. This grows downward, leaving a small gap in the center called foramen ovale. Okay. So this is the second tissue growing right side called septum secundum, and it leaves a small opening called foramen ovale. Okay, these are the two openings. So this is the first opening and this is the second opening. So there are two openings. Now next, how the circulation is done when the baby is inside mother's womb. Okay, from placenta the blood goes into RA. Okay, what blood goes in the sense, the oxygenated blood from the mother goes to the child. So that is to the right atrium. It is the bypassing method when there is a hole. It doesn't go to the lungs. Instead, it goes through the foramen ovale to LA. From LA, it goes to LV, then to all the body parts. In the sense, when the child after birth, how the blood circulation is means, from inferior and superior vena cava, the blood comes into RA, that is the deoxygenated blood comes into RA. From RA it goes to RV, from RV to the lungs through pulmonary artery, from the lungs to the LA through pulmonary veins, from pulmonary veins it comes to LA, from LA to LV, from LV to all parts of the body. This is the circulation of the baby after birth. Before birth, from placenta, the oxygenated blood goes and it doesn't go to lungs. Instead, it bypasses through this foramen ovale and goes to LA directly. Okay, this is the method. That's why the holes are present. Next, after birth, actually these holes get closed. In the sense, the foramen ovale gets closed. It is how means the ostium primum and the ostium secundum gets fused and it forms a septum, the single septum, so there is no holes for the blood to pass through, and so the circulation, how it begins, from RA it goes to RV, from RV to lungs, from lungs to LA, from LA to LV, from LV to all parts of the body. This is the circulation. But in case of atrial septal defect, in case if the baby is having atrial septal defect, it is how means the septum which is going to get fused doesn't get fused, that is left as a opening itself, so it is called defect. Okay, the defect is of two types. One is ostium secundum and ostium primum. These are the two defects. It is how means first defect is ostium secundum. In ostium secundum cases, it is the common case. 90% of cases occur ostium secundum, and ostium primum is only 10% of cases. It is a rare case. In the sense of ostium secundum, the septum secundum and the septum primum. The septum secundum and the septum primum the septum secundum and the septum primum should get fused, but it doesn't get fused. Okay, so in this what happens in the sense, this both gets fused and a hole forms. This is left off as a defect. Okay, this is left as defect. Okay, this is called defect. So this is opening. This shaded part is the opening. So this is closed, this is also closed, and this is left as a defect. This is called ostium secundum. This is the This is 90% of cases occurs in ostium secundum. Okay, this is the defect. Next one is down of this at the end part. If there is a defect, that is called ostium primum. It occurs only in 10% of case, mainly in Down syndrome. 25% of this defect, ostium primum defect, occurs in Down syndrome babies. Okay, this is down of ostium secundum. Ostium secundum is this means directly down of that. Okay, down at the end part. Okay, that is called ostium primum. Okay, these are the two. Next, let's see about the shunting. How the shunting happens. In right and left, the left has a higher pressure and the right has a lower pressure. So there is a shunting called left to right shunt. From higher pressure to lower pressure, that is the more oxygenated blood gets mixed to the right side in the sense with deoxygenated blood. Since there is no bluish coloration, and it is called acyanotic. Since the oxygenated blood is getting mixed with deoxygenated blood, it goes to pulmonary circulation and gets oxygenated. Okay, since the oxygenated blood gets mixed with the deoxygenated blood, there is increased saturation in right atrium, right ventricle and pulmonary artery. Actually there is deoxygenated blood, so the saturation could be low, but when the oxygenated blood gets mixed with this deoxygenated blood, it gets more saturated. So when there is an increase in saturation in right atrium, right ventricle and pulmonary artery, because why means the oxygenated blood gets mixed with deoxygenated blood, so there is a rise in the oxygenation in right atrium and all. Okay, extra blood crossing the pulmonary valve means normal blood crossing the pulmonary valve is increased because of mixing of blood. Okay, when there is a extra blood crossing the pulmonary valve, there is a delay in the closure of pulmonary valve. Okay, Next, the clinical signs and symptoms of ASD are difficulty in breathing, that is dyspnea. Okay, palpitation, fatigue, then chest infections like frequent respiratory infections, that is called chest infections, then cardiac failure, arrhythmia, mostly asymptomatic. Okay, next, clinical signs. What are the physical signs? That is splitting of S2 sound. When the doctor hears the chest heartbeat with the stethoscope, he can hear a splitting of S2 sound. That is called splitting S2 sound. Okay, next we can see diagnosis. What are the diagnoses? Is X-ray, ECG and echo. Treatment, there are two types of treatment. One is surgery and one is cardiac catheterization procedure, and one other is medications. They give medication in the case of small opening, and surgery is done in the case of bigger opening. They measure it in the echo and they decide the procedure whether it is a surgery or a device closure. Surgery is done as open heart surgery in the operation theatre. In the surgery, the defect is closed with a patch closure, and in the cardiac catheterization lab, a device closure is done in the sense a metal device is closed. Thank you for listening this class. I hope you all understood what is atrial septal defect.